Hi, I'm Dr. Geeta Patel from Ahmedabad. I'm a dermatologist and I've been practicing since the last 19 years. Today I'm going to talk to you about my skincare routine. I have an extremely dry skin, which means that my face can't protect itself against the harsh environmental pollutants. So when you have a very dry skin, you develop cracks in the outermost layer, and which compromises on the hydration. So also you have to remember that in dry skin you have to be very vigilant about what kind of a cleanser you would use. So in my day care, let's divide my skincare routine into day care and night care. So in the day care routine, first thing is the cleanser. As I told you, I use a very gentle, non-foaming, fragrance-free, non-irritating cleanser. And I always make sure I use cold water to wash my face. It's never hot water. Hot water would strip all the natural oils of my as it is dry skin. So I never use hot water on the face. Even when I'm in the shower, I take care never to use hot water. After the cleanser is the toner, but I skip on the toner. After that, I apply an antioxidant serum. What is an antioxidant serum? So antioxidant serums are nutrient-rich, supercharged molecules which have the capacity to blunt the inflammatory responses which are induced by the skin due to ultraviolet rays and the environmental pollutants. That's the most important thing, and they are very thin, so that's the first thing that I apply. So after that I just dab an under eye cream in my under eye area. This helps to keep the area elastic, also helps against the collagen loss. You have to remember that nothing is magic and results don't happen overnight, and you have to remember this is a lifelong commitment. After the under eye cream, if you have any concerns like you have a random acne, you could just put on a spot treatment for that particular area. After this comes a moisturizer, very important step. After all the havoc that is wreaked on our skin by the ultraviolet rays, the environmental pollutants, it's very essential to lock in the hydration. It's very essential to apply moisturizer, not only for the face, for the entire body after the bath. When the skin is still damp, you could put on everywhere. Put on the moisturizer, and then last of all, I put on a physical sunblock. And because I have a dry skin, I make sure that the physical sunblock has a moisturizing base, or you could skip the moisturizer and put on a sunscreen with a very rich moisturizing base. So that was about the day care routine. Now coming to the night care routine, which is equally important because at night the skin renews and repairs itself. So take a good look at yourself before you apply the things at night. If you find your skin is irritable, then you got to hydrate it and protect it. If you find it's dull, then you need to exfoliate it. And before you put on anything, or rather before I put on anything, I remove all the makeup with micellar water. It helps to remove the excess oil, the excess sebum, the grime and the makeup that I had applied previously on the day. After I remove the makeup with the micellar water, again the first thing that I do is put under eye cream. So why should we have a separate under eye cream and a separate face cream? Because the under eye area, the skin of the under eye area is much thinner and is very prone to show signs of aging and much faster. So we have a separate set of under eye serums and eye creams. So that's the reason. So I put on the under eye cream. After I apply the under eye serum, I apply the treatment serum. What is the treatment serum is basically the active ingredient. Now I generally apply what is required that time, not what is lying in my medicine cabinet. So it can vary from retinol, alpha hydroxy acids, or just a plain moisturizer. So it all depends on what my skin requires that time. That is what I generally put. After I put on the treatment serum, I put on a thick moisturizer as I have a very dry skin. And a thick moisturizer is because it would take several hours for it to get absorbed, and the skin would heal over a few hours when I'm asleep. But sometimes it just maybe wash, moisturize and go to bed, and there's always tomorrow to give your skin so much more love. If you found this video helpful, please share, comment, like or subscribe to Skin Diaries.